Good morning, friends. Again, this is Dr. Sharjil, and I'm here with another video of a very important topic, that is postpartum psychiatric disorders. Before starting, let's understand what is the meaning of postpartum. Postpartum is the period after childbirth, and it lasts up to the 6 weeks of childbirth. This is the period where body organs return back to their pre-pregnancy state. Let's begin our topic, that is postpartum psychiatric disorders. Postpartum psychiatric disorders are an episode of mental illness which begin suddenly within few days or weeks after childbirth. Types of mental illness. These are baby blues or puerperal blues, postpartum depression, and postpartum psychosis. Now let's come to the baby blues. Many new moms feel happy at 1 minute and sad the next. And if you feel better after a week or so you probably just suffer from baby blues. Symptoms of baby blues. These symptoms are mild and short-lived. There may be short-lived depression, anxiety, sadness, irritability, crying, headaches, exhaustion, a sense of inadequacy. Causes of baby blues. What are the causes of baby blues? No specific metabolic or endocrine abnormalities have been detected, but lowered tryptophan level is observed in some cases. It suggests altered neurotransmitter function. Treatment of baby blues. What are the treatment of baby blues? These are reassurance and psychological support by the family members. However, further evaluation is necessary if symptoms persist longer than 2 weeks, because it may be postpartum depression. Now, symptoms of postpartum depression. First, emotional symptoms. These are increased crying, irritability, hopelessness, loneliness, sadness, uncontrolled mood swings, feeling overwhelmed, guilty, fear of hurting self or baby. Now, behavioral symptoms. These are lack of or too much interest in the baby, poor self-care, loss of interest in otherwise normally stimulating activities, social withdrawal and isolation, poor concentration and confusion. Now, physical symptoms. These are exhaustion, fatigue, sluggishness, sleeping problems that is not related to the screaming baby, appetite changes, headaches, chest pain, heart palpitations, and hyperventilation. Postpartum depression risk factors. These are self or family history of mental illness or substance abuse, marital or financial stresses, birth complications, lack of self-confidence as a parent, problems with your baby's health, major life changes around the time of delivery, lack of support or help with baby, the mother being of young age, severe premenstrual syndrome. What are the causes of postpartum depression? So let's see. After pregnancy, hormonal changes in a woman's body may trigger symptoms of depression. During pregnancy, the amount of two female hormones, that is estrogen and progesterone, in a woman's body increase greatly. In the first 24 hours after childbirth, the amount of these hormones rapidly drops back down to their normal pre-pregnancy state. Researchers think the fast change in hormone levels may lead to depression, just as smaller changes in hormones can affect a woman's mood before she gets her menstrual cycle. Now, treatment for depression. Treatment should be started early. Serotonin reuptake inhibitors like fluoxetine or paroxetine are effective. They have fewer side effects and they are safe for breastfeeding also. Estrogen patch has also been used. General supportive measures are same as those were for baby blues, and overall prognosis is good. Now let's come to a very important topic, that is postpartum psychosis. Postpartum psychosis is rare. It occurs in 0.1 to 0.2% of all births. It usually occurs within 1 to 4 weeks after delivery. Higher risk associated with bipolar disorder. Postpartum psychosis, if left untreated, then it can lead to child abuse, suicide, and infanticide. Treatment. Before treatment, let's come to the symptoms of postpartum psychosis. Symptoms are delusion. That is, delusion is an unshakable belief in something that is untrue. Second is hallucinations. Hallucinations are a sensory experience of something that does not exist outside the mind. Sleep disturbances. Obsessive thoughts about the baby. Rapid mood swings. Extreme anxiety and agitation. Suicidal and homicidal thoughts. Now let's come to the severity of different postpartum mental illness. postpartum baby blues are less severe and most common. Postpartum depression are moderately severe and affect approximately 8% to 20% of the women. Postpartum psychosis is the most severe one. Now let's come to the management of postpartum psychosis. First, exclude medical causes for mood disturbances, that is thyroid dysfunction or anemia. The initial evaluation includes a thorough medical history, physical examination, and routine laboratory test. Let me tell you that these things should be done in case of postpartum depression also. In case of postpartum psychosis, psychiatrist must be urgently consulted. Chlorpromazine is started. Sublingual estradiol results in significant improvement of the symptoms. And if these treatment fail, then electroconvulsive therapy may be considered. Lithium is indicated in manic depressive psychosis, and if lithium is used, then in that case breastfeeding is contraindicated. Friends, this is done. This topic is complete, and I hope you find your answers in this topic, and this topic is very useful to you. If you like my video, then please don't forget to like, subscribe, and give comments. Thank you. Bye-bye. I'll come again with other videos very soon, within few days.